very, very busy time. Oh, there she is. Hi, welcome. Good, you're here.
Good morning.
We can get started. Thank you all for attending our Board Quality Committee meeting. Our focus today is an in-depth review of safety across our system. You have already received the safety dashboard and the culture of safety survey results from last week via email. And I'm sending around now our serious safety events report. This is for internal review only.
Thank you. Here you go.
And before we start, I want to welcome a very special person who's joining us today. Laura Weiss is a nurse in our orthopedics group.
Welcome.
And she recently experienced a serious safety event at our GI labs. She's here to tell us her story today. Thank you for joining us, Laura. Well, we have a lot of ground to cover. Why don't we start with the safety dashboard? Anyone have any questions about the safety dashboard?
I do. At all your clinics and your 14 hospitals, your average scores on most of the dashboard dimensions have either met or exceeded their target. I'll be honest. I run a venture capital firm. When we're evaluating a company for investment and their data consistently shows that they're exceeding their target, I have to wonder whether or not setting your target too low.
Yeah, most of us would like to see all green lights on the dashboard. But when I joined the system about 6 months ago, I actually noticed that we were setting our targets based on our past performance. We are raising the bar each year just enough to stay in the green. That is not how we should be doing that.
It sounds like you're your own benchmark.
Exactly. Leadership discussed it, and we agreed to join an improvement network that allows us to see other health systems' performance on safety metrics and allows us to share ours as well. But we also want to look at the variances across the system. For example, one of our ICUs has had a very high rate of central line infections. And one of our OBGYN clinics has had a very low rate of hand hygiene when compared to others.
Sounds like a much more useful way of analyzing and then using the data.
We agree, and thank you for pushing us to look deeper. I'm very excited about advancing these safety analytics and capturing more of the variances that take place across the system. Shall we move to the annual Culture of Safety survey?
I have difficulty with one term. Can you explain what non-punitive response to error means?
It's a measure of what we call psychological safety. It reflects how safe our frontline staff feels when reporting concerns or errors to leadership. Right now, we're at about 69%.
Now, I wasn't sure if that was a good or bad number when I reviewed this at home.
It's not where I would like us to be, but as with the safety dashboard, we want to also be looking at variances across the system. And one of the things we've been working on is building a just culture where people feel comfortable that they will be treated fairly and will be valued when they identify problems. And it gives us a chance to remedy the problem before a patient is harmed. The first serious safety events that we will be discussing took place in our GI labs. 3 patients experienced a hospital-acquired infection caused by improperly sterilized and endoscopy equipment. And now might be a good time to reintroduce Laura, who is one of those 3 patients. Laura.
Thank you again for the invitation. As a nurse in the West Hospital Ortho Clinic for almost 12 years, I never thought that I'd be a patient harmed here. It's hard to be here today. I know how many wonderful things we do for our patients and how many times we do things right. But that's not what happened at all in my case. I came in for an endoscopy to evaluate my stomach ulcers. I felt awful a few hours after the procedure, and I came into the ER. They thought that I had the flu, or I was still recovering from anesthesia. So I got sent home with ibuprofen and anti-nausea medication. When I woke up the next morning, I had a fever of 104. And I was so weak and unstable that I had to have my husband drive me back to the ER. I was immediately admitted to the ICU, where I spent 4 days battling a bacterial infection called Pseudomonas, which I later found out was due to the endoscopy equipment having not been sterilized properly. I lost 2 weeks of work trying to recover. It was a big financial hit to my family.
We are so deeply sorry for all that you've been through. In terms of evaluating this process, we've looked at a number of factors. Workload, distractions, what might cause a tech to deviate from the standard sterilization protocols. We've rolled out retraining for all staff around endoscopy sterilization. And we've created a monthly monitoring system to evaluate the entire process on a regular basis.
Hospital leadership kept me updated on their findings and invited me to the process improvement efforts. And they also credited me for all of the charges on the care. And we are working to recover my lost income through the risk management department.
Good to hear. During our onboarding training, we learned about incident reports. Were Laura's and the other cases reported by staff?
Only one was entered into our incident reporting system. Some events are obvious when they happen. Others are not. So it's important that we link into other ways of identifying harm, such as patient complaints, claims, and our own EMR analytics.
So how do we close the loop on all this?
Well, we'll be analyzing our progress at the GI labs. And we're going to follow up on the endoscopy sterilization process improvement, and we will report the results back at the next board meeting. Why don't we take a quick 10-minute break before we talk about our performance on CMS safety metrics? Quality is keeping patients safe.